Hi, my name is Karina Carmian. That's me. And I'm doing my project on dementia. The reason why I chose to do this topic about dementia is that my grandfather was diagnosed with dementia in 2011. This is my grandpa and my grandma on my mom's side. Aren't they so cute? I wanted to gain a better understanding of the disease because my grandfather was showing signs of forgetfulness and memory loss, but everyone in the family on my mom's side thought it was just because he was getting old. It started to gradually get worse, and sometimes he would get confused how to get to work. This was when my grandfather had to retire from work at the age of 90 years old. Now that he is diagnosed, I feel that I need to learn more about the disease so I understand what he is going through, and perhaps I can help my family understand. Dementia is not a disease with a specific or unique symptoms. It's a combination of various diseases that cause a decrease in the mental ability involving language, where people have a hard time forming sentences and sometimes communicating. Memory is forgetting who family members are and where you live. Cognitive skills is forgetting how to make decisions with basic tasks, and this can actually prevent someone from living an independent life. Forgetfulness is the first sign of dementia, and this could be where someone forgets what day it is of the week. Personality change is where someone can become depressed, quiet, and even violent when they used to be a very happy, outgoing person. Perception is where someone has a hard time understanding and being aware of what they are seeing. All of the following symptoms gradually became apparent with my grandfather through time. It eventually got to the point where his cognitive skills weren't really there anymore. He struggled with putting on clothes, and he got really confused really quick and forgot how to do basic tasks that he's done all of his life. The three most common forms of dementia that progressively get worse are Alzheimer's disease, Lewy body dementia, and vascular dementia. Alzheimer's disease, there is no exact reason on why this disease happens. The researchers have found that the cause of Alzheimer's disease is linked to two genetics and two different types of abnormal proteins. The Alzheimer's Association talks about how there are two categories of genes, risk and deterministic genes. The researchers have found to cause Alzheimer's disease. The risk genes increase the chances of someone getting the disease of the gene APOE4 and is believed to have been the cause of Alzheimer's in 20 to 25% of patients. People who inherit the deterministic gene will automatically inherit a disorder, which is being accounted for 5% of Alzheimer's patients. Alzheimer's kills active brain cells, which causes the brain to shrink faster than it would by aging normally. By examining brain tissue, doctors have identified two abnormalities, plaque and tangles. Plaque are abnormal clumps of protein that disrupt communication with brain cells and are more prime suspect in Alzheimer's disease. Tangles occur from twisted proteins that cause failure of the transport system in the brain, which is needed to transport nutrients. This is generally known to start at the ages of 65 to 70 years old, is the sixth leading cause in the United States, and people who generally live around 6 to 8 years after being diagnosed. Lewy body dementia affects 20% of patients diagnosed with dementia, and the onset is usually caused by age. Lewy bodies are abnormal clumps of protein that have been found in the brain of people with Lewy body dementia, Alzheimer's disease, and Parkinson's disease. It has similar traits to Alzheimer's disease, but patients with LBD have fluctuations with their memory, hallucinations, and being able to think clearly without getting confused on their thoughts. The three common traits that help diagnose is REM disorder, which involves hallucinations, kicking, thrashing in your sleep. 2, movement disorder, such as Parkinson's disease, which later turns into dementia. And 3, Alzheimer's symptoms, but have cognitive functions, with being able to form clear sentences, change in walking, attention, or alertness. Vascular dementia happens when blockage of an artery that prevents oxygen and nutrients from reaching the brain. From the Alzheimer's Association, it states that changes in the thinking skills sometimes occur suddenly following strokes that block major blood vessels. Thinking problems also may begin as mild, then worsen gradually as a result of multiple minor strokes or other conditions that affect small blood vessels, leading to cumulative damage. This accounts for 20 to 30% of people who have dementia and is the second most common form. There is no cure for progressive dementia, but there are medications to help slow down the progression of the disease. Once doctors are able to diagnose a certain type of dementia, they are able to use the appropriate drug for each type of dementia to prevent any negative effects. If found early enough, doctors are able to reverse or stop certain forms of dementia that are caused by medication, brain tumors, alcohol abuse, and change in metabolic levels. There is not an exact way to prevent dementia, but there are suggested ways to lower your risk. People that have family members that have a certain form of dementia have a greater chance of eventually getting it, so it's important to be aware of this and start early with doing things to prevent it, such as doing activities as reading, writing, drawing, working out can stimulate the brain and help prevent dementia. Even managing stress and maintaining a healthy diet can also be helpful. In the CBS News article, Dementia Risks Greater for Out-of-Shape Middle-Aged Adults, talks about how researchers performed a clinical trial with 19,000 participants to evaluate if those who exercised lowered their percentage of getting dementia. Researchers discovered more than 1,600 cases of dementia among the group, and a closer look revealed those who were most fit at an earlier age were about 40% less likely to develop dementia compared to those with the lowest fitness levels. While doing research, I found out that my grandfather's two sisters also had dementia, but both of them passed away a couple years after being diagnosed. I feel that the suggestions about lowering your risks for dementia all tie to my grandfather's lifestyle. I believe it's quite possible that one of my grandfather's parents would have had dementia if they didn't die so young. Therefore, I have learned a lot about what dementia is, and I now have more knowledge of dementia and can help support my grandfather through these changes and make sure that he can get properly diagnosed by a neurologist to prevent any negative side effects from wrong medications. Applying this information, what I've learned, I'm sure this information will help my grandmother as well. This information benefited me because I don't want to get dementia when I get older. And I need to make sure I stay active and keep working my brain so I can hopefully prevent dementia in the distant future.